Hi everyone, my name is Darian Thomas. I'm a student midwife, and this video is an educational video on infant male circumcision. Male circumcision is a popular practice around the US and around the world, and I want to make sure my clients are educated so they can make an informed decision whether or not they want to circumcise their infant. Male circumcision is a surgical procedure that involves removing the foreskin from covering the gland of the penis. And I just want to make it clear that neonatal circumcision is a requested elective surgery. It is not a medical necessary surgery that is routine and medically needed amongst all newborns, males. And it is not commonly practiced across the world like it is here, like it is a routine, practice here in the United States. This foreskin that is on the penis usually starts in utero at about 12 weeks of gestation and is completed by about 20 weeks of gestation. This is a natural formed anatomy part of the body. The foreskin is meant to be there. It is on pretty much all newborns as they are born and naturally grows in utero. There are different techniques used to circumcise an infant. Most commonly, though, the infant's penis is numbed with local anesthesia, for example, a topical or an injection like a lidocaine to help numb the area, and so that won't be painful, ideally, to the infant. And it also involves using like clamps, really large clamps. Some can look like this, some can even look like this, the hemostat, or the Kelly clamps, or, it can even look like these ones. There's different clamps out there to be able to, open up the, to stretch the foreskin so they can get a better visual of the urethra to make sure they're not, cutting anything but the foreskin, and they can either use a scalpel, a very sharp surgical scalpel, or maybe even some sterile surgical scissors to cut that foreskin. And of course there is risk and chance of bleeding, and that is why it's very important that male infants who are getting circumcised receive vitamin K, because they are not, they're not born with that clotting factor right away. And this clotting factor, of course, helps the blood clot in the event of a bleed or hemorrhage. And of course, there is some post-operative care for the newborn as well. For example, there may be some dressings around the, area to capture any excess bleeding. And it's very important to only clean the infant's penis with water only, no soaps, no scrubs, anything like that. Be careful when wiping to not irritate the area, and keeping the area dry and clean to prevent any infections is very important. Healing usually can take about 4 weeks, and with that being said, for the infant, that's 4 weeks of discomfort, especially when urinating. There could be some burning sensation or just some discomfort with the diaper, pamper in general. You want to make sure there's not any ointments that are going in that area during the time of healing as well. A summary of benefits and limitations/drawbacks that are associated with infant male circumcision are now coming. Some benefits include the complication rate is very, very low, like only 1.5% of complications occur when neonatal circumcisions are done. There is a lifetime risk of urinary tract infections being reduced by 20%. There's less exposure to HIV and HPV and other infections like yeast infections in the long term and going into adulthood. No proven side effects relating to sexual pleasure, satisfaction, activity, or sensitivity. And also, strong evidence supports the risk of eliminating penile cancer, although rare. And there is the idea that male genital hygiene is significantly improved with circumcision. And again, there are some drawbacks. Some of those drawbacks include the fact that removing the foreskin is unnatural. Again, this is an elective requested surgery. This procedure offers, no protection against sexually transmitted infections. For example, chlamydia, gonorrhea, trichomosis. The procedure is permanent. It is relatively painful, not therapeutic, and irreversible. There's a possibility that the person who's performing this surgical procedure can leave too much skin or remove too much skin, resulting in a need for a second surgical procedure to fix that. A family's preference should always be followed unless there is a medical contradiction. Otherwise, talk to your provider and make sure that the person who is performing the infant circumcision is well skilled and highly trained. And yeah, thank you for listening. And I'd like to add, if you notice that there is any super red or pussy, any signs of infection, a foul odor to the area where the circumcision was formed, please contact their baby's provider to get them checked again to prevent and reduce the chances of infection.